Great. So I will open the meeting on Thursday, December 4th at 5:03 p.m. Um, in attendance are myself, the board chair, Risha Hess. We also have Jack Jemsek, Betsy Brooks, and Premila Nair. We also are joined by Kiko and Maheen from the Public Health Department. So, all that said, I do have, we'll start with the reviewing of the minutes. Did anyone else have any comments on the minutes?
You use the word else?
Oh, sorry, is that Betsy? Go ahead, Betsy.
Yeah. No, I just said you use the word else. Does that mean someone does have comments?
Oh, I do.
Okay, that was.
Guess that was implied. Okay.
I was going to save mine for last if anyone else. Jack, were you starting to say something?
Oh, I'm just saying that it's on the hearing
Yeah.
only. Yeah. I don't have anything at the moment. Yeah.
Okay. Like all of us, I would think. I read my own portions the most with the most fine-tooth comb, just to make sure what gets put in posterity of what I'm saying feels accurate. And I will just note, so there's not page numbers embedded, but it's on page 2 under board member discussion. The second paragraph says R has discussed ... And the very end of that sentence says, which hopefully can result in a statewide ban on nicotine sales to young people. And I would just note that that's not actually what NFG would do, because those young people would be slightly older people and eventually old people. So maybe nicotine sales to future generations of young people, or I don't recall exactly what I said, but that was not.
Maybe to future generations rather than and leave the young people out. Good
that was
catch.
the only thing well, I hope you all read your own quotes with the same fine-tooth comb, but I didn't catch anything else. And as always, I'm deeply impressed by our notes.
Mm.
Okay. And Maheen, you noted that for correction?
Yeah, I wrote it down.
You found it? Okay, great. Anybody else?
No.
Okay.
Nope.
Okay. Will someone make a motion to approve the minutes with that correction?
I move to approve the minutes with that correction.
And
I'll
I
second.
Well,
Yeah.
either.
We'll give it to Jack.
Sure.
And all those in favor either say aye or raise your hand.
Aye.
All right, so that's unanimous. Great. So next on the agenda is public comment. And before we open for public comment, I do want to make a clarification. We will not be, we closed public comment on nicotine free generation and Kiko, I didn't double check the date. Do you have it top of mind?
It was November 12th, I believe.
Okay, November 12th. And so we will not be accepting any more public comment on nicotine-free generation before our vote. We will have another public comment section at the end of this meeting if some people want to, after the vote, say anything that they want to comment on. But this first public comment section is reserved for non-nicotine-free generation comments. Hopefully that's clear and fair to everybody. So if you have a comment that is not about nicotine-free generation, if you can raise your virtual hand in Zoom, and we will call on you in the order we see you. Kiko is generally timekeeper. Please keep comments to Is it 3 minutes, Kiko?
2 minutes.
2 minutes. All right. Thank you very much.
So I do see one hand. So again, a reminder that this is for non-tobacco related comments. So if you have a non-tobacco related comment that you want to make, raise your hand and we will call on you in order. Right now, I see just Jonathan has raised their hand. So Maheen, do you want to
Yeah, I can.
promote or unmute?
Yes, Jonathan, I'm sorry. I know this is generally Board of Health. Just asking to allow outdoor smoking in general. That's it.
Sorry, can you repeat that? I didn't catch it.
See, I just said this is a Board of Health meeting. I was just hoping you'd at least allow outdoor smoking, at least outdoor smoking areas in general, and that's it.
Okay. All right. Yeah, and that's not about tobacco or nicotine-free generation, so happy to take that comment.
All right. Okay.
Thank you.
All right.
Just taking notes. Are there any? I see a second hand.
Peter, you can go ahead. Please identify yourself and say where you're from.
Oh, good evening. Peter Brennan. I am with the New England Convenience Store and Energy Marketers Association. I understand the assignment here, no comments on NFG. I've already submitted my opposition to NFG. So I hope that, those comments that I submitted in writing would be considered before the vote. So instead, my comment is just on the process that, I do disagree with the board's decision to not take any additional public comment before the vote. I understand there was a hearing held in person. I was not able to make it. I know of a lot of people that were not able to make it. So I hope that the comments that have been submitted, via email, snail mail, whatever, have been considered appropriately, since this would seem to be the best venue to let people have their voice heard before a vote is taken. So again, not commenting on NFG, I'm opposed to NFG. I think it's a foolish policy, and I think that a city like Amherst that attracts so many young adults could get a bad reputation in the mind of those looking to go there for school if it's seen as kind of a hyperactive nanny government that will not let adults purchase nicotine products. But again, I've submitted comments, and I just wish there was more opportunity for the public to share their thoughts.
Great. And just to confirm that any written comments before that deadline were taken into account, but email, snail mail, however. And thank you.
Okay. Stephen Helfer, I'm going to allow you to speak.
Brennan's comments, I will not comment on the proposal. I have submitted detailed emails to the board, which I think refute some of the assertions made by proponents of this policy. And I am disappointed that I cannot reiterate them now and see the board's reaction. But rules are rules, and I will observe them. Thank you.
Thank you.
I see Emily Waija. I'm going to allow you to speak. And please introduce yourself.
Oh, sorry. Hi, my name is Emily Waija, and I live in Cambridge. And I just want to say that I agree with Peter and with Stephen. I also submitted written comments, and I was not able to make the in-person hearing. So I'm also disappointed that I can't express my opposition to nicotine-free generation before the board. But I thank you for allowing me to just say this. Thanks.
Thanks. I'm just looking at hands and I don't see any. I'll give it a few more seconds. Okay, and with that, we will close this section of public comment. Again, there is another section at the end of the meeting. Just to comment on the process, we were not able to take a vote at the end of the public comment session because we did not announce that we would be taking that vote at that session. But that is, for all intents and purposes, the end of the public comment was the 14th. And if you did submit anything before that date in writing, an email, snail mail, however, it was read by all board members and will be considered in the vote. So with that, our first item on old business is the vote on nicotine-free generation. We had a discussion after the last meeting, in the meeting, but after the comment section of the meeting. I don't know if if any of you have had different thoughts or additional thoughts that you want to voice before we take the vote.
So Risha, I wanted to remind you that there are a couple of things in the regulations for people to review and talk about specifically.
That's true.
Yeah, including the finding structure and a few other comments that I put in the margins.
Okay. And so the way that we should do this, should we take a vote on the concept first, or should we vote on the regulations? I guess that we don't actually take a vote on the concept, we just vote the regulations, right? But I guess in my mind, we have to have agreed on whether or not we're putting in that regulation to then address the specifics within the policy. Does that make sense to others? That we'll take a vote, as it were, that does nothing binding on whether we want to include it, and then we will look at the specific wording and make sure that that is correct one way or the other.
Yeah, you can say that you're getting consensus on certain components of the regulations.
We'll see where we stand on adding or not this section. It doesn't have to be an official vote. So with that, did any of you have any further comments, discussions you wanted to have on the issue since our last meeting? I'm not hearing any or seeing any. Did everyone feel like they said everything they wanted to say? Asked all the questions they wanted to ask?
I suppose I feel like the black market aspect of things to as a workaround. I don't particularly like the prognosis of that, existing. And again, so I kind of struggle with it because I know, hey, smoking's bad. I guess in the minutes I said I was a former smoker, but I guess yes, I have smoked in the past. So, but I'm not a smoker now. But I guess I'm definitely struggling with this because it feels on a local level, it's making a statement. I understand how local builds, national policy, but to me, it just seems like there's it's just feeding this black market.
Just to clarify, by black market, are you talking mostly about online sales? Is that,
just sales that are just done that are not recorded.
Okay.
Not through the stores. And so it's what's the term of that type of material that is on the black market?
Contraband. I think your terminology is right.
Yeah.
Sorry, Pramila suggested contraband.
That's it, contraband. Thank you, Prama. Yeah. So, and anyway, I have problems with how, alcohol was dealt with in that regard with, prohibition and things like that. It just seemed not the right result. But I understand we're trying to get healthy as a community and in a nation. But yeah, I mean, we do have all these colleges and things like that here, and um, you know, might be a tad on the overreaching side. So anyway, just that I'm struggling with its place, but I would vote an affirmative for it because I feel like it can be undone easy enough if we see it as being problematic, but down the road anyway.
I will say almost to a T, almost, that the young people who spoke at the hearing were very supportive of NGF, which was significant to me.
Mhm. Personally, I don't really see smoke. I'm not around, the youth at that age, so much, but I really don't know many people that smoke these days. I think people get it in general. So maybe a moot point that I'm worried about.
We should be so lucky that we don't have to worry about it at all. I don't have a great answer for the black market. I think I've been thinking about it more in terms of what it does to online, pushes people online where we don't have any reach. But again, I don't think that's a reason not to pass what I would support in a regulation. It's more of a, well, can we look at what it takes to start getting into online regulation, if that's really where the problem is going to lie. So I agree, and I've said in the past that I am. This isn't something I'm jumping up and down enthusiastically supporting. I do have reservations as well, but yeah, similar to Jack, I also would absolutely vote to put this in the regulations.
Can I just say two things? One is that I do know, and this was referenced in the minutes, that there is a piece of legislation that's been introduced at the state level to do something about online sales of tobacco products. And so it's currently under consideration, just to think about. And then the other thing is that one thing to remember too is this is not an out and out prohibition. Tobacco products are still available for sale in stores. So it's a little bit different from, with the alcohol situation, you couldn't get it anywhere. So there became an underground market for that. There's already an online market for many, many products, including tobacco products. We're talking about restricting sale of these products to people of a certain age, certain generation. So it's just a slight nuance that might have a bit of a, influence on how you're thinking about this.
Yeah, you're right. Thank you, Kiko, for that clarification.
Anyone else have any further thoughts or comments or questions? Okay, well, since I don't see anyone and I don't have anything, shall we take a consensus vote? I don't know how else to state it. A consensus taking whether we want to add nicotine-free generation, so that is banning all sales of nicotine and tobacco products to anyone born after January 1st, 2005, into our tobacco regulations. Maybe I'll just go around. Is that easier than having hands? Well, Betsy, you're the only one who can't see hands.
Okay.
So
I'll start.
Sure.
I'm in favor of this. I must say reluctantly in favor, but in favor, and come down voting for it.
Is there anything you want to say on the record about your reluctance?
I think there are two parts of it. One is just feeling that this is a moment of rebellion against public health. And I'm very concerned that about backlash against overreach, and I'm very concerned about vaccination policy. I also wonder whether there's an age at which this might max out and it has achieved its mission, maybe age 25 or something. And I share that, for students who are not brought up in Amherst in a college town, that could be an issue. But I think on the whole, I feel like it is a step in the right direction. And if it appears to be causing bigger problems than anticipated, or that further research either makes it really clear that these concerns I have are not issues, then that's great. If it makes it clear that a different that there's a maximum benefit at a certain age, I'm open to reconsidering this in the future. So I feel like on the whole, I'm in agreement with the move.
Great. Jack, do you want to go next?
I'm in, again, general agreement with knowing that it is a very slow moving in its impact. And I think, I do think there'll be, state and national regulations that'll be coming along while this is in place. But no, I don't have anything else to add besides that.
Okay. And so you're in. You're
Yes.
in for adding it to the regulations. Okay. Pramila?
Yeah.
Yes, I agree with adding it in.
Okay. And I will say I do as well. I think the most motivating aspect for myself is the supporting other towns and trying to make this something that the state takes a look at. Okay. Well, then it's the details of what it looks like in writing. There was attached to the packet the regulations revised. A few things have changed since the last version. The primary is just the restructuring of the document to fit back towards the state template, so it is easier to read for folks who work across towns. And then, of course, adding in the date of January 1st, 2005 as the nicotine-free generation throughout. There are a couple of specific questions that I know we have to address. Maybe we'll start there, and then we can come back to any other things that anyone saw if they haven't been addressed in those questions. So the first, see if I can get these right. Kiko, you might need to help me out. I think the first one, if we are on page 12 in the violations section, we have agreed in the last meeting that we will go back to having local fines and state fines, meaning that the regulations that are passed at a state level would be 1,000. Where is this written? Is it 1,000, 2,000, 5,000 for first, second, and third violations? For policies such as nicotine-free generation that are at a local level, generally, we agreed that they would go back to 300, 600, and 1,000. And part of that is just an administrative burden of fines that are over $1,000. So before I go on to the next, everyone still okay with that? Okay. So then the question comes up, is a 300, 600, 1,000 penalty structure adequate for a violation of nicotine-free generation? Or do we want to make an exception for that? And Kiko, maybe you can explain. It is what is done by all the other municipalities, if I'm correct.
As well, I don't actually know that, and that's why I invited Cheryl Sabara to come to
Okay.
this meeting. She's in the waiting room, and we can promote her to panelists to have her answer some of these questions. But I do know that in Belchertown, that's the way they've done it, that it's $1,000 fine if you sell to someone born after January 1st, 2004 in their regulations because they were passed last year. So I think, Cheryl, if you could promote her, Maheen. I think the question is, is there another way to do it? Can you set it up in your regs so that you say if you sell to someone under 21, it's the state fee of $1,000, but if you sell to someone who was born after January 1st, 2005, but it's 5 years from now and that person is, 23, that's only a $300 fine. That's the question, if I articulated it clearly, I think.
Can you repeat that question? Because you threw me for a loop there at the end.
So in the Belchertown regs, in the spot
Right,
where
they have a separate 1,000 just for violating NFG, and the rest are lower. The fines are lower for
Right.
other local sections.
Yeah, I mean, they have a statement that just says in the place where in the model regs, it says if you sell to someone under 21, it's a $1,000 fine in the model regs. In the Belchertown
Correct.
regs, it says if you sell to someone born after January 1st, 2004, it's a $1,000 fine. There's no wording about under 21. It's simply selling to someone
Correct.
born
They
after. Right.
used the same fining structure for the nicotine-free generation as they did for the state violations that are mandated. So
Right.
are you asking if someone sells to someone under who was born before a certain date, or after whatever, if they violate the NFG portion of this, you can fine 1,000. You couldn't go higher than 1,000 for violating NFG because this regulation is passed pursuant to Chapter 111, Section 31. So you couldn't have 1,000, 2,000, 5,000. You would have to keep it at the 1,000.
Max 1,000. Yeah.
Yeah. So I would say most, although we have about 20 of these now, most of them do not do what Belchertown did, but I think that more and more of them are going to start doing that.
So then most of them are doing what exactly?
Whatever your local fining structure is what they're doing.
So, okay, so then because I think what Belchertown did is they simply remove any reference to people younger than 21. They simply
Correct,
say,
because they're
right,
using
because
NFG, which is what you're
right.
doing, you would be doing as well.
So I think that's my question. I think there's some people in the group who feel like selling to someone under the age of 21 is very egregious and warrants a $1,000 fine. But selling to someone who in 4 years' time, if this passes, in 4 years' time, you sell to someone who's 24, you shouldn't be selling to them because they were born after January 1st, 2005.
Correct.
That's not as bad as selling to someone who's under 21, and you should only fine them $300 for that.
And that's totally within your board,
okay.
Your purview.
So that's within the board's decision. I just hadn't
Absolutely.
seen anybody else do it that way. I hadn't seen any other municipalities do it that way.
I haven't either, other than Belchertown. Right. So that's totally within your purview.
So Kiko, I think what she's saying is she's not seen anyone do it the Belchertown way, not the
Correct.
opposite. And you're saying the opposite.
Correct.
I'm saying the opposite. Okay. I've only seen the Belchertown regs. I haven't seen any others, so I didn't know how other municipalities were doing it.
Okay. So Pramila, Jack, and Betsy, is the issue at hand clear, or should I try to restate it?
I think it's clear.
So we have to decide whether we think that tobacco-free generation violations would adhere to our local fine policy, or would they be $1,000, similar to the state? And just a question on, so I think Cheryl was clear that it's a $1,000 fine for the first violation, but it can't be $2,000 for the second. And so it would just be 1,000 for the first, 1,000 for the second, 1,000 for the third. Is that how?
Correct.
Okay. So our choices are keep it as a local fine, which is our 300, 600, 1,000 for second and third violations, or keep it at 1,000 no matter which violation it is. Anybody have opinions on it?
So the first version, which is the local version, is enforceable, and we have no issues with that in terms of using that. So I'm fine with just using that model.
Pramila or Betsy?
It's okay with me for us to keep it with the other regulations that we have, in line with the other regulations.
With the local fine structure? And Betsy? Betsy went on mute.
Okay.
You're on mute again.
Am I muted now?
No.
No, you're good.
Okay. Yeah, no, I agree with keeping it on the local fine structure. I think that's simpler and that's appealing.
Kiko, did you want to give any rationale for moving it to 1,000?
No.
Okay. I think the minutes of the last meeting reminded me that we had talked about the fear really being about license being taken away or suspended versus the fine themselves. And so I think as long as that's still part of the regulations, then I'm also good with the local fine structure. So I think we heard everyone's good with local fine structure, so we'll put it that way. Kiko, are there any other questions on that point that we need to?
For the local fine structure, the group had talked about 300, 600, 1,000 at the last meeting, so that's what I put in the draft. But we didn't talk about the license suspension to your earlier point, so I just put in what was there before, which is in the case of the first violation, it's just the fine of 300. In the case of the second, it's the fine of 600 and a license suspension for 7 days. And in the case of a three or more, it's a fine of $1,000 and the license suspended for 30 consecutive business days. So sometimes people do less than that, 15. 30 is the max. So I just wanted to put that also out to the group for discussion.
Anyone want to make a comment? So the current is 0730 in terms of the days that your license is suspended for first, second, and third violation.
That sounds fine to me.
Same here.
I agree.
Okay. And then on the state, is it 730? Am I reading that correctly?
Yeah, for the state, it's 730. And this was something that we discussed before as a group, because there's also some variability there. The state doesn't dictate the number of days that can be chosen. So that's something that you all discussed in quite some detail before.
Okay. So then is there any desire to move ours in line with states that it's 730, or shall we keep it 0730? And I guess the only argument there would be that the local regulations are somehow less severe. And so that first violation wouldn't have an automatic 7-day suspension. I can just read out loud. The local violations are nicotine-free generation, sale of blunt wraps, smoking bars, minimum sales regulations on cigars and other cigar-related, and tobacco sales and healthcare institutions, educational institutions, roll your own machines, display of license, no having a permit, density minimums, transfer of permit, oral nicotine pouches, and then it just says other. To me, a few of those feel a little bit lesser in severity than others, but they're not all less severe. The selling a tobacco in a educational institution or healthcare situation feels pretty bad to me.
Of course, they don't have a license to do that.
They also don't have a license, so they'd also be in violation, but the license is just ours. It's still a local. Sales without a product sales permit. So you're right, then it would hit the state. Any opinions one way or the other?
I think it could be reconsidered if it turns out that there's a lot of scofflaws on this, but I think the intent is the important part here, and that there is an enforcement mechanism.
All right, so 0730 then is what I'm sensing. I'm sensing that people don't have strong opinions or are okay with 0730. Does that feel right? Okay.
It's a
and then what?
It's a softening, but still a commitment.
Yeah, I think that sounds right. It seems like everyone agrees. I think the other thing to think of in terms of being maybe more harsh for those scofflaws, as you call them, Betsy, is what we have under Clause D, which is also in yellow highlight on page 13. And again, this is taken from the Belchertown regs, which is that if there are 3 violations of nicotine-free generation, essentially, the board would hold a hearing in accordance with this regulation, and after such a hearing may permanently revoke a tobacco sales permit. So that's a little bit harsher. Again, completely up to this board as to whether you all want to include that.
And there's plenty of time for, it's not a mandatory, and there's plenty of time to give warning. So I think that gives it real teeth, but not, allows for some education over time.
It's a mandatory meeting. The revoking of the permit is something that the board would decide at the time.
Right, and it's also after 3 violations, so there's a lot of time for education in between there. Yeah.
I'm also happy to add that in. I think that seems like a good add. Pramila or Jack, any objections to it?
No, I agree.
Okay.
Fine.
And then you had some wording questions for Cheryl.
Yeah, I just had one quick question for you, Cheryl, is just on the non-criminal disposition and the separate violations. So first, the non-criminal disposition, that's just what you were talking about earlier, that for, fines exceeding $300, you have to do a cease and desist, right?
Correct.
Right. And so local fines can't exceed 1,000, and if they're more than 300, you have to do
a cease and desist, correct?
Right, which is what we do whenever someone sells to underage. We issue cease and desist for that $1,000 fine. So we're accustomed to doing that. So my question was, does that have to have it's a very silly question, but I just want to make sure we have everything right. Does that have to be a separate section? Because in the model regs, it's just a bullet under violations. In the model regs, it's a separate section, like enforcement is below or severability is below. Does that matter?
No.
Okay. Perfect. I think that concludes everything that I made notes about in the draft.
I have a question. And section C, it says in the case of 4 violations or repeated egregious violations of any section of this regulation, do we need a definition of egregious, or is that, I'm just curious about the use of that term.
That's a really good question. And it's really up to the judgment of the Board of Health as to what egregious actually means. It's hard to define it. I can give you examples where boards have revoked a permit. I can give you one example right now if you're interested in it, but it's just one board's decision that the behavior after a permit had been suspended, the retailer continued to sell tobacco products, even though they were supposed to have been removed from the premises. And he was operating under a 30-day suspension. He sold tobacco products on 4 different occasions to undercover police officers. That board determined that behavior to be egregious. But again, that's that board's judgment that that behavior was egregious.
Well, I wonder if the word egregious needs to be there. I mean, 4 violations, well, or repeated violations of any section of this regulation. Just seems to me it makes sense to leave subjectivity out of regulations.
Cheryl, that revoking held up, right?
Yes.
The court would say you had a
Well,
right to
the court,
have this hearing.
what happened in that case is that the city solicitor's office, it was challenged, and the city solicitor's office defended the case. It never went to court, but the city solicitor said that that was up to the Board of Health to determine whether that was egregious or not, and that he would not substitute his judgment for the board, and that he felt confident that the court would not substitute its judgment for the Board of Health. But it can, I understand what a previous member said, and that's totally up to you whether you want to take that word out.
I'm not uncomfortable with it staying in. I feel like it's a little bit like the word pornography, like you know it when you see it. Egregious. One can imagine maybe 2 35-year-olds coming into a store might not be egregious, or two, at some future date. But I think having some community standards of reasonableness and egregiousness, unreasonableness, I'm okay with that. I think it's too hard to define it or not have a standard of both of those options are hard.
Yeah, I think, Pramila, I generally come down on the side of not being as explicit as possible, and yet I would not want to try to define egregious. So I feel like we're either at take it out or leave it in, rather than try to get more specific with what egregious means.
And that's what I meant. Was there some mutually agreed upon definition of egregious? I wasn't really thinking it would be so cumbersome to have to spell that out in the regulations. So that was my question. Again, I think it's good to be as clear as possible. I don't really have a problem if it stays in. I just wanted to raise that as a potential issue.
I think I'm sort of in line, which is I'm okay either way. I think I tend to say maybe leave it in to give the board some flexibility if something isn't quite at 4, but it feels like they're really not listening to the regulations or not adhering to the spirit of the regulations, as it were.
Yeah, in considering the wording again, I see, it says in the case of 4 violations or repeated egregious violations, which could be theoretically less than 4. So yeah, that's fine.
Okay. Anyone else
Only
catch
10
anything?
10-year-olds.
Yes.
That would be egregious.
Anyone else catch anything? And I used else again because I have. Kiko, I have just incredibly minor punctuation and formatting, and I don't think it's worth discussing at this meeting. So
Okay.
if we do agree to approve this version, I assume people are fine if we add some periods and change some font sizes at different places. Those are the only level of, and then the only actual change is that the date at the bottom says 2004, and obviously it would need to be 2005.
Speaking of, not, this isn't a punctuation thing or anything, but it is something that probably needs to be corrected on page 1. It says, the last sentence says spitless tobacco, including oral nicotine pouches, sales have increased from 100,000 units a year in 2018 to over, I think the number there is 7,000. There's something missing there.
Which I'm
Page
I
1
haven't
of
found
the
where.
draft regulations, the last sentence.
Spitless tobacco.
Yep.
Oh, right. That's not a number.
That's what I
it
was
looks like
thinking.
7 million with the comma in the wrong place.
Oh,
It
I
should be
see.
700,000.
It should
Yeah,
be
I see what you're saying.
700,000.
Yeah.
That's a good catch.
Okay. Yeah.
All right. So what we have in front of us then is adding the nicotine-free generation language, splitting out local and state fine structures and keeping nicotine-free generation within the local fine structure, and adding that if there were, sorry, I got away from that section. If there were 3 violations on the nicotine-free generation, they would have an automatic hearing with the board. Have I captured all of the major changes?
Yeah,
I think so.
I think so. So then and I appreciate, Risha, your attention to commas and formatting. It's always good to have fresh eyes looking at something. So we'll get it looking shipshape. Then we will also need to put in language about, because it doesn't have it right now, if you sell to someone under age 21, it's $1,000 fine, because that's not what it says currently. Yeah. So we'll need to change that. But that's easy enough to do, not a heavy lift. I think the other 2 things are, and changing the date at the bottom. Obviously, the effective date of this regulation and enforcement of this regulation are 2 more things for the board to talk about.
Say more about the enforcement. What's the question there?
So and again, Cheryl can feel free to jump in here, but I'll just state what the issue is. I think we've written this that it's going to be anybody born after January 1st, 2005. You can't sell to anybody born after that date. So we want the effective date to be January 1st, 2026 of these regulations. We want them to go into effect right away. That's really soon. This is the way Belchertown did it. They did it in December and it was effective within a month. I think waiting until the following year is not a good idea. So we want it to go into effect now, but we wouldn't enforce it right away. That was the recommendation that has been made. You can have it effective January 1st, but you can educate, and then let people know that we'll actually be enforcing starting July 2026.
Yeah.
That seems reasonable. July seems reasonable.
Yes.
Okay. It's nice to think about July right now, given the weather.
It'll come again. Okay, so yeah, I think both of those will keep our date of birth, and I like having a lag until enforcement of 6 months.
Okay.
All right.
That's it.
Is it voting time?
I believe so.
All right. So does someone want to motion to pass let me get the title. The changes to restricting the sale of tobacco and nicotine products as we just outlined.
So moved.
Seconded.
Okay, thank you, Betsy. And all in favor?
In favor.
All right. It's unanimous. It passes.
Thanks,
Good job,
everyone. I know this has
team.
been a long road. Deep breath. Whew. And Cheryl, thank you ever so much for your ongoing support and assistance and jumping onto our meetings at the drop of a hat. Really, really appreciate it. Thank you for helping us with this.
Not a problem. Am I excused?
You're excused.
Mhm.
Okay, great.
All
Thank
right,
you.
Take care.
All right. So I want to flag that we are at about 7 minutes before the hour, and we are hoping to get to public comment at 6:25. Just for all. The next old business is on the waste hauler proposal, and I think Kiko, you have a brief update, and then Jack had attended a meeting on our behalf.
Yeah, so I think Premila, you had requested this be on the agenda, and I do have an update, which is that I really do think thanks in part of the advocacy on the part of the Board of Health members, that a contractor has been engaged to develop the RFP for the waste hauler. So that contractor is Pioneer Valley Planning Commission, and the town council committee in charge of the waste hauling issue just met with PVPC today. So that is moving forward. That's the update that I have. I hope that's what you wanted. I don't know. I don't have any other info to share, so.
I wonder, the only other question I would have is, what is the timeline?
Yeah, great question. I don't have an answer, but I can certainly find out, because I think they just met this morning and I had a busy day and didn't get a chance to get the
Sure, no
latest.
problem, of course.
But I can certainly communicate that information to the board via email.
Great, thank you.
Yeah, I know the Pioneer Valley Planning Commission has a contract signed by the town, and so all that detail should be, readily available in terms of the timeline and the scope. I'd be interested in seeing
Yeah,
what the scope of work is.
right. Okay.
Yeah, I think they were able to sole source it to them for the reasons that they're a quasi
Governmental
state agency.
organization.
Yeah.
Yeah. Yep.
Great. And Jack, do you want to give a brief overview of the meeting you attended?
Yeah. So that meeting, there were 5 speakers. They're kind of disjointed between them, but the common theme was about using your own containers to take leftovers, from restaurants. And I guess, I guess people bringing in their own equipment into a restaurant isn't necessarily it can be frowned upon, right? So it's incumbent on the local government to facilitate that happening. So you're using less paper and less disposable items for takeout, basically, for leftovers and that sort of thing. And I can bundle this together. I can zip together their presentations. I think it looks like it's 10 megabytes. I just zipped it up. And the website basically says, have you ever asked yourself while at a restaurant, can I refill my own drink or food container? Can a restaurant refill a container? Can a third-party organization handle the washing of a refillable container? And so, so there's these sanitary aspects when you start allowing people to minimize waste by bringing in their own thing. So sounds like it can be done. They had one person from Ithaca, college town, that the restaurants had a little plaque on their window saying that they were receptive to that sort of thing. And Mount Holyoke College is the most advanced, I think, of local institutions near us that are doing this sort of thing, is my understanding. And I have a contact person from there, that Sonia Williams. She's with True Zero Waste. Anyway, she offered to help if we wanted to explore this further. But I think that's the just.
Would it take changes in regulations, or is it just a Like what
Yeah,
does
I
it
mean,
take from a town?
yeah, there is, it does apply to the food code. And so there would be a process, but I'd have to, I don't know what our food code is right now, in this regard. So that Kiko, I don't know how knowledgeable you are.
So I'm not that knowledgeable, but food code
uh,
is set by the state. So food code is state law, and then we at the local level are charged with complying with state food code. So I think it's a question of understanding how being able to do this is or is not in compliance with state food code and ways to work around that. I don't know if there's a regulation that can be passed to sort of restructure. I'm not knowledgeable exactly. So I think it would be interesting because this is all in the interest of reducing waste, right? That's what we're talking about.
correct.
Fewer
Yes.
takeaway containers in the garbage, which is something the
Yeah.
Board of Health is interested in. So I think it's an area for further exploration. It's interesting to know that Mount Holyoke is doing
Yes.
something around it.
Yeah.
And I don't know what kind of regulations would need to maybe pass so that we're still in compliance with food code. That's a question mark. I'd need to do more research and talk with my colleagues in inspection services, but it's an interesting idea.
Yeah, and I don't, again, I think it would be, maybe good to have Sonia, attend our next Board of Health meeting and advise us. I think she'd be willing to do that. But yeah, I don't know if there's are any barriers
Okay.
necessarily.
Jack, thank you so much for attending the meeting on our behalf. Are you so motivated to take it forward, or would you like to hand that off to one of us to liaise with Sonia?
Oh, no, I can contact Sonia. I was going to do that today, but I didn't get
Okay.
around to it. But yeah, so do we want her to speak at the next meeting?
Hard to say without knowing what ends up on the agenda, because it's always a question of
Yeah.
time. But
Or
yeah,
we could have just a phone call with Kiko, her and myself, just to kick things off to
sure.
see
And
what's
then
out
maybe if
there.
there's time on the agenda that we can add her.
Okay.
That
So
would be
I'll work
great.
with Kiko and Sonia on getting more understanding of this.
Great.
Yeah.
Sounds good.
And then we'll move into new business. And we're still on Jack.
No.
Jack has suggested that we consider sports gambling as a public health issue. And Jack, did you want to say more about that?
Well, the alarm bells go off for me, and I don't know if it's warranted or not. But I don't know if you've watched any professional sports or any sports at all, you'll see that gambling is legal and it's out there, and they happen to be major advertisers for a lot of the sports programming now. It's really out there. And what little information I have, gambling addiction, again, with young men is a thing, that's concerning. And it's just kind of scary to me. And I looked and see, well, is it a problem? Number one, I guess a little more research to see locally what's going on. But in essence, there's nothing that the Board of Health can really do other than what is it called? I had an example. I put this into to Chat GPT to see what could be done, but it would just be a resolution that we would issue as a body, as just a statement, but with zero enforcement, basically. But if we care to do that, I think that's about all we could do.
And it was a resolution. I'm looking for it as well. I think you shared it, but what was the crux of it?
Well, it said a resolution declaring that gambling-related harm, including sports wagering, is a public health issue affecting residents, families, and the broader community. Legal sports betting was introduced statewide in 2022 under the oversight of Massachusetts Gaming Commission. While the law regulates betting operations, the board notes that gambling can lead to serious public health consequences such as anxiety, depression, financial hardship, family stress, and addiction, particularly among youth and young adults, particularly men or boys, who are most exposed to online and mobile betting. Someone said like having your phone is like having a slot machine in your pocket, uh, for kids. So, or for adults too. um, and the board's action would, seek to reduce its negative health impacts through education, prevention, and local collaboration, basically.
And I think you also shared, sorry, I'm not seeing the things that I thought I was seeing before, but I think you also shared a link that WHO has stated that gambling, I don't know if it's sports gambling, is a public health issue. So there is
Yes.
certainly precedent for including it as a public health concern.
Correct.
I'm not sure where to go with it. I guess the idea is to have a further discussion about it at a future board meeting and decide if we want to have the resolution. Is that the?
Yeah, I mean, I guess if we want to look and do sort of like an informal community health needs assessment on our own, I could help. I could do that on, back burner kind of things. The urgency isn't high, but we can have it,
And
on a list as something that we're
yeah.
looking at.
Well, we certainly have that running list, and we should add it to that. I
Yeah.
think the other component is that I suspect our college populations are key in this risk area, and liaising with UMass and Amherst to see if they're already doing things, if there's
Exactly.
things that
Yeah, I was
would be
thinking the
supportive.
same. I was thinking the same. Is this even on their radar or not? So yeah.
Yeah,
The-
on that note, I do have a close relationship with the public health director at UMass Amherst. They have their own public health department on the campus. And so I'm actually meeting with her tomorrow about a number of things, and I've added this to my list. So I'll ask her if there's anything that's currently underway on the university about this on the campus.
Great.
Yeah.
Is this the
Yeah, I
time
mean,
to? No,
go ahead, Betsy.
no. When you're done with this issue, and thanks for bringing it to attention.
Oh, okay. Yeah, I guess I've witnessed some people that are that do have addictions and it's just kind of sad to see with regard to it just seems like an out of control lifestyle. And so just kind of putting some guardrails in place somehow. Again, I don't think we have much in the way of enforcement, but something that, because this online gambling is new relative to being legal, and then it's present everywhere for professional sports. It's just, I find it alarming.
Yeah, appreciate you adding it to our agenda. I hadn't thought about it in the public health space, and as soon as you brought it up, it was clear to me it fits in the public health space.
Okay.
All right. So that's
I don't know if this is the right time to do it, but on the topic of things that are topical, the New York Times this weekend had a piece on e-bike safety.
Yes, I saw that.
And I wondered whether we have had any experience with that with the e-bike rentals in town, and I was just wondering if that had, if we've also registered whether there's an e-bike accident injury problem and whether the bikes that are in town fit into the things that are considered safe. And I realize there's a little piece of work to do with that, and I haven't done it, but I read it yesterday, and it did seem like that was something that, given the e-bike rentals across town, was probably worth having on our radar.
Great. That's another great thing to add. And I have not read it, but and I don't read the New York Times, but I can research it on a different way.
I'll send it along on the article to everyone. It was actually quite scary. Basically the death rate from e-bikes is very, very significantly higher than it is for other bicycles. It's of an order, like 2 orders of magnitude. Was that it, Kiko?
That sounds right. I don't remember exactly, but yeah.
It was a stunning amount. And I think, compounded by the fact that not everybody has familiarity with the bikes, and people tend not to have helmets on, and they're more like mopeds. Some of them are more like mopeds and motorcycles than they are like regular bicycles. So head injuries and chest injuries, significant ones, and death are just several orders of magnitude more dangerous than conventional bicycles.
Great. Kiko, is there anything else in this possible new Board of Health topics? I can't recall.
I don't think so. Nope.
So then the next item is our meeting schedule. We did speak with a prospective board member. I know we have one slot to fill, and it would be great to have next year's schedule with their schedule in mind. However, they will not be applying, and so we will not have a new board member by the beginning of the year. They have given some leads for other people, so hopefully we can keep going with that. Just to, yes, Jack.
So they're just like kicking the tires or something, or how was it that you talked to them, or that
a name had been suggested of someone in the public health sphere who's local, and they determined that they didn't have enough time to commit to the
so
board.
they were finding out more about it, and
yeah. So it's our 4 schedules that matter. I guess 6, because we need all of us here. Does this time still work for people? Is there any request to change it? So it's the first Thursday of the month is what's on the...
I frequently have a conflict with the first Thursday. The second Thursday would work better for me, but if it doesn't for everyone else, it's fine. We can keep it the way it is.
I feel like, Jack, you were the person that the second Thursday didn't work for.
Let me see.
I'm sorry, does anyone mind if I sign off now?
That's okay, Betsy, but you had said at the beginning of this meeting that these meetings tend to conflict with things. Is that just because of holiday stuff for you, or?
Just is all random. Like, I'm retired, I'm not that busy, but it just happens that every time we have a meeting, it just happens. This is as good as any day, so I think.
Okay.
Yeah, so the monthly meeting that I have is the 3rd Thursday. So the first Thursday, second Thursday works, and then I have those quarterly ones sprinkled in there. They look to be the second Thursday. They look to be this. So the first Thursday certainly is is optimal for me.
Yeah, I actually now have a conflict on the second Thursday, so I can't do the second Thursday any longer.
Is Thursday the best day of the week for everyone?
Yeah, I think so.
I could do
Pramila, so that
I could do another day. And again, if
what
we
would
meet first Tuesday would be fine. I don't,
what would the first Wednesday or Tuesday look like for you, Jack?
Tuesdays I usually have something at this time. Wednesdays, yeah, Wednesdays. Yeah, I guess generally Wednesdays are okay.
Okay. Kiko, do you want to put out a sort of feeler and see if everyone, after they check their schedules, if the first Wednesday would work? If not, we may need to keep it the first Thursday. Pramila, sorry. I don't quite know how else, or unless someone has another suggestion.
Okay, so first Wednesday starting January 7th, which is the first Wednesday of January.
Okay.
Um,
Just put it
okay.
out for one more confirmation, especially since Betsy is now not on the call.
Sure, will do.
Okay, and then we're over to you for director's update.
And before we get there, just one other thing, which I'd mentioned briefly to Risha, but it's just about the meeting packets, which we sometimes send out a week beforehand. Lately, we've been sending it out maybe a couple days beforehand. Sometimes there's late breaking stuff. So just to rewind, we need to get the agenda posted 48 hours ahead of time by open meeting law. So it has to be done by Tuesday. If our meetings were on Thursday, it has to be uploaded by Tuesday at 5 at the latest. So generally, we've been sending you meeting packets on Tuesday as opposed to sending them to you a week ahead of time. So my question was, and Risha came up with a good suggestion. I'm just going to float it by all of you. Is like, we will make a best effort to get it to you a week ahead of time, because it seems like that gives you a little bit more time to review. But if there are late breaking additions to that agenda within the, before the 48-hour cutoff, we might send you some additional something 2 days before the meeting. But we would really hope to have everything finalized a week ahead of time. And does that feel like a better way to do it? Because right now, I don't think we're on the best. It's kind of, just haphazard when you're getting the packet. So I just wanted to put that out there. Excuse me.
So I think the suggestion I had was to send something a week in advance, and then just know as board members to expect something 2 days in advance that may be additional to what was sent. It may not be.
Yeah, that sounds good. I think it's good to have a little bit more time, and then of course, if things are, things develop, that we, excuse me, receive more information. But excuse me.
Okay, so we can sort of be in a cadence of sending you things a week ahead of time, and then 48 hours ahead of time. It's just, reminder, we'll see you in 2 days. Oh, and here's some late breaking addition. And that's that. So you'll get kind of 2 notices from us. Okay.
And just do call out in the body of the email if there's additional things that have been added, so we know to look for them.
Okay. Okay.
Great.
So let's see.
Sorry, Kiko, I just want to make, I absolutely have to leave by 6:30, so,
I will make it brief.
Create a problem in terms of quorum, or because Betsy's not here, but anyway.
Yeah, okay, I'll just quickly go through this. We sent out a respiratory illness update to everyone in town, and we posted on the website, just wanting everybody to understand that COVID, flu, common cold, any kind of sniffles, we're really treating it all the same. If you have some upper respiratory infection, stay home if you're sick. When you're feeling better enough to return to work, wear a mask for 5 days until you're really completely recovered. And really, testing for COVID is not as critical as it once was during the height of the pandemic, because we're not doing anything differently from COVID as, with compared to other things. For people who have underlying risk conditions, testing for COVID or flu might be helpful if you want to take Tamiflu or Paxlovid. But other than that, it's the same recommendation if you've got cough, cold, fever. So just underscoring that and putting it out there for people, trying to make it simple at this stage of the game. So that if you subscribe to the text messages that we send out, I don't know if you all do that. You can subscribe on the website to text alerts, and public health occasionally pushes out alerts about respiratory illness, about the tobacco hearings, all that stuff. I think as board members, it's probably good for you to be connected in that way. So I recommend that you sign up for those if you haven't already. But right now, levels are pretty low. COVID has been pretty low. We're expecting a rough flu season. That's the word from people who watch these things closely. It's already ramped up significantly in Japan and Canada. So we're concerned about a pretty heavy flu season. We'll see what happens. Maybe I said this last time, but we did have an underage tobacco sale at Amherst Market, 259 Triangle Street, sale to an underage person. So they paid their fine and they had their license suspended for 7 days. So that's been taken care of. But just for the board to know that that did happen in October, the sale occurred. We've been doing a lot of work around food security, especially when the SNAP situation was really tenuous. We were just getting a lot of information out there to people about places to get free food in Amherst. So we put together a nice one-pager. Again, this has been pushed out through the text messaging system with the town. It's on our website. It's on our bulletin board. We just want people to know what's out there. We're similarly really concerned about housing with the cold weather, huge cuts to housing, all sorts of things that are going on. I was on a call this morning that was really depressing. So just really worried about people staying safe in the winter and being housed and sheltered this winter, especially with temperatures tonight even expected to drop into the single digits. And it's not even technically winter yet. So just a little concerned about some of these are more, vulnerable neighbors facing some challenges these days. And I guess the last thing I'll say, and Betsy's not on, but Risha, this pertains to you, is just about emergency preparedness. So Risha, that your name is listed on this web EOC system, as is Betsy's. We needed 2 contacts from the Board of Health in addition to me on this emergency communication system that the state runs, which frankly is not that practical, which we've never really used, which we have to do updates to that don't feel particularly relevant. So all of that's kind of in flux right now. There's been a lot of changes to the system, and I'm trying to sort out what's happening, trying to get Amherst up to date with our emergency planning, just because we want to be poised to respond to something kind of disaster, whether it's a public health thing like a pandemic or flooding or fire, which we had fairly recently. So just I think there may be more involvement, or at least more updates that I want to give the board about emergency planning and why your names are given and what your responsibility is as a board in the event of an emergency. I need to be working on that in the next couple of months with our emergency manager, who is the fire chief. Chief Stromgren is the emergency manager for the town. So between him and me, we're supposed to update our emergency plan. So more on that to come, but I just wanted you to know that that's kind of in the works. That's it for my update. Any questions? Okay, that's it for me.
All right. Then there's topics not anticipated by the chair. Any? I'm not aware of any. Jack?
I'm just kind of curious with the zero waste coming in to play and the potential composting component to it. There's no other really committees in town other than the Board of Health that's deals with waste. Is that correct? I mean,
well, there's the TSO.
Oh, but that's
Town Services and Outreach.
So okay, so they would be active in terms of implementing.
In terms of what?
In terms of implementing what would need to be done in terms of education.
I don't know about implementation. I do know that comes under their bailiwick, as it were, but I cannot speak to the details of the
Okay.
nomination.
All right. So I was just looking, I didn't really see it. So you feel like TSO will be able to handle
So,
some of the implementation?
yeah, I mean, Premila,
implementation.
TSO is the committee that's meeting with PVPC. Is that correct?
I don't
With
know.
the town.
I don't know. I know that the sponsors of the proposal originally are on the TSO. And I believe that, well, I don't know. I'm assuming that they would have to be updated.
Yeah, and there's a town council committee. So I don't know. I'm still figuring all this stuff out. The town council committee is the
TSO is a
TSO.
town council
Okay.
committee.
So
That's
they're
what
the
I thought,
ones,
yeah.
they're the ones that
Yeah.
are interfacing with the PVPC about this waste hauler proposal. So they're sort of the content experts that are guiding this. When it comes to implementation, I think it's a DPW town thing, and that there have been some questions about capacity to implement something new. That's why we need to sort of figure out what this really is going to look like, or who's going to manage the contract for this waste
Yeah.
hauler that does composting if that's what ends up happening. There need to be a staff person who does that.
Yeah. So I'm just saying, I'm a scientist. I know environmental stuff pretty much. When it comes to composting, I don't, and I feel like I'm realizing like I can be composting a lot more than what I do in my home. And I just don't think people think about it. So there's just the thought occurred to me that there's gonna have to be a big education piece down the road.
Agreed. Thank you.
Yeah.
And I think some of the groups that brought it to our attention and who have been proactive in it would be sort of on board for taking up some of that education side because they seem better connected into the details of it all.
Mm.
Yeah.
Great. Anything else? Okay. So we have our public comment section. I see there's still one person attending. If you would like to make a comment, please raise your hand and we can put you into the meeting. Okay, and if not, we made it by our 6:30. And thank you, everyone. And we will confirm the date of the next meeting based on that email. Because it'll either be a Wednesday or a Thursday, it looks like.
Okay.
All right.
Sounds good.
Thank you, everyone. Have a good December.
Yeah, Happy
Bye-bye.
New Year if I don't see you before then. Happy holidays.
Okay, happy holidays,
Take care,
everyone. Yeah.
everyone.
Take
Bye.
care. Bye.